We're in the middle of a huge measles outbreak.
Exactly.
And I wouldn't even call it second guessing. If you think about it, there is not a legitimate scientific organization in the world that recommends separating the MMR into 3 shots for measles. There is not a nation in the world that separates the 3 shots into 3 shots for measles. And the president was saying, I think that's the only way to do it safely. The entire basis for that idea comes from a study that was published over 25 years ago and then retracted because it was scientifically invalid. That's it. There's no study that examines it. There's no recommendation from a legitimate group. There's no nation in the world that does it. And the president is sending a message that the vaccine, which is absolutely necessary to stop this outbreak, is not safe. And that is incredibly dangerous. It's not just second guessing. It is essentially making up an entire case out of thin air in the middle of the biggest measles epidemic we've had in over 25 years.
And so just the other point for that for me, and it goes to the heart of this, I'm sorry, I started talking tonight about simplistic stupidity. And this is a very good example of that. To your point, taking something that has been disproven medically and scientifically, taking something that has been identified is not correct because it is harmful and therefore is not valid, and then putting it into the mainstream of conversation. You know, God help us, we can't help stupid parents who don't want to be helped. All right. But someone has to care for their kids. And that is, if you're going to expose children like that, it exposes the entire universe of kids. Because how do school systems, do public health systems deal with this?
I don't consider parents stupid. I think they're confused. And I think if they, for example, support the president politically, they may want to take his medical advice in this case. But that would
He's not a doctor.
That would be very dangerous.
That would be stupid.
Right. Well, I would say that, you know, I am worried about those parents. I'm worried about their kids. I'm worried that they are going, you know, when I worked as the health secretary for the state of Maryland, you know, I was responsible for every child, regardless of who their parents voted for. In public health, we're thinking about every child. And I think the most important thing here is for parents to turn to their pediatricians and not look for an Oval Office press conference on how to vaccinate. This should not be about politics. This should be about science, medicine, and the people that you trust to take care of your children.
Yesterday, the president said from the Oval Office, nothing bad can happen from what we're doing. Stephen Miller, his deputy chief of staff, he claimed that no one has studied the impact that childhood vaccines in the way that the schedule currently recommends parents move about the vaccination of their children, what the impacts are, which of course is not accurate. As somebody that's got a 4-month-old child myself, we're going through those appointments right now, and it's a lot to get a kid in.
So I'm worried about your 4-month-old child because that child is too young to be vaccinated against measles. Every 4-month-old child in the country is too young to be vaccinated against measles, but we have a raging measles outbreak in parts of the country, and that is very scary for parents of 4-month-old children because you can't protect them. The only way you can protect them is if enough people are vaccinated that there's not measles virus circulating, and we're losing that control.
I want us to show up on the screen. Caroline Leavitt, the press secretary for the president, posted this image of comparing an American child and the number of vaccine injections that they are supposedly getting versus a European country. They're 72 injections. And I think it's worth noting that about half of those are annual flu and COVID vaccines. And it's not a child that is getting that. That is up through the number to the age of 18 years old. Well, can you put into context what the reality is of the image that the White House is depicting?
That is a completely misleading image. The U.S. is not an outlier in the number of vaccines that it gives. I think the U.S. vaccinates against 17 diseases, South Korea 17, a bunch of other countries 16, a bunch of other countries 15. You know, the president likes to talk about Denmark, which is down at 10. That's the outlier. The U.S. is right in the middle. And in fact, in this country, we do a lot of vaccine science. We have fantastic vaccine studies, and we have actually, launched a bunch of vaccines that have saved many lives. I mean, I'm a pediatrician. I have been in the intensive care unit. I have seen 4-month-olds with pertussis. I've seen the stress on their parents' face where they cannot stop their children from coughing, and they're worried whether those children will live, and some of them don't. You know, there's so much at stake from the fact that when we vaccinate children, we are protecting all the children. And the result, if we, get misled, if we get confused, is that we wind up losing that control and we could turn the clock back to a time when parents routinely lost children from vaccine-preventable diseases.
Dr. Charcine, we have the largest outbreak of measles since the disease was declared eliminated in 2000. There are 2,465 confirmed measles infections in the United States so far this year. Already surpassed the total number of confirmed cases in 2025. 1991 was a record year for measles cases with 9,643 cases. And that was a 65.3% decrease from the 27,786 cases reported in 1990. That's according to the NIH. When you look at a country that folks in the White House and this administration, RFK Jr., say, this is the greatest country in the world. And yet, what I just read you, we had eradicated something. We had moved past it. The work that you and your colleagues had done for years in making sure that children around the world, all of us, got the MMR shot in some way, shape, or form. When you think about where we are as a country, as a health professional, what do you say to parents? What do you say to the parents who now are concerned that this is an administration that is changing the schedule, that is telling doctors that they don't have to give all of the shots that the CDC has said in the past, and therefore maybe your insurance won't cover it? What do you say to those parents?
Well, what I think pediatricians are saying to parents in this situation is that my recommendations haven't changed. The American Academy of Pediatrics recommendations haven't changed. I'm still vaccinating my own children if they have children. They're connecting one-on-one. They are relying on the trust that's been built up. That's why the surveys show parents have a lot more confidence in their pediatrician than in politicians to tell them what to do. But, we are going to lose measles elimination status. And for a long time, the administration's been saying, we're doing everything we can on this epidemic. In fact, even RFK was saying, I'm out there, I'm telling people to get vaccinated.
Too late.
But what just happened? They came out and they said that the shot that we're all relying on is unsafe, essentially. And they are confusing parents in the middle of an outbreak. So the question of whether or not this is being responsibly managed has been asked and answered. It is not responsible to put out an executive order calling into question the safety of a vaccine that is known broadly to be safe in the middle of an outbreak that has killed a couple children, is putting a lot more children at risk, and could get a lot worse.